MedShake.
Hi, I'm Anca, and this is the place to be to hear about the latest tech trends in healthcare. Ever wondered who sets the rules for AI in healthcare? When machines make medical decisions, who makes sure that they are safe, ethical, and fair? Today, we are talking about one of the most ambitious projects ever designed to answer those exact questions: future AI. This isn't just another tech buzzword. It's a global, consensus-driven framework designed to ensure that AI in healthcare isn't just smart, but also responsible, transparent, and trustworthy. Welcome into the Meta Health. Let's start simple. Future AI stands for 6 key principles: fairness, universality, traceability, usability, robustness, and explainability. Together, they form the backbone of what's being proposed as the first international agreed-upon guideline for building and deploying trustworthy AI in healthcare. Imagine AI systems that recommend cancer treatments, predict heart attacks, or scan radiology images, such as we have seen in previous episodes of the podcast. These systems are powerful, but if they're trained on biased data or deployed without oversight, the consequences can be dangerous. That is where future AI steps in. Despite rapid progress for AI in healthcare, adoption in real-world hospitals and clinics is still slow. Why? Because people don't fully trust these systems yet. Concerns about bias, lack of transparency, patient safety, and data privacy have held back real-world implementation. Previous efforts to guide AI in medicine have focused mostly on reporting standards, but none of them covered the full AI lifecycle, from design and development to deployment and monitoring. Plus, many didn't involve a wide enough range of voices. Future AI aimed to change that. It was developed over 2 years, involving 117 experts from 50 countries, including AI scientists, clinicians, ethicists, and social scientists. This global collaboration makes it one of the most inclusive and comprehensive initiatives in the field. So how was it built? The process followed a 7-round consensus model, something called a Delphi method, a structured way of gathering expert input and refining ideas through repeated feedback. The team started by reviewing existing research and identifying the biggest challenges in healthcare AI. Then, they created working groups focused on each of the 6 future AI principles. Through online surveys, meetings, and voting rounds, they developed 30 specific recommendations that address every step of an AI tool's life. Let's break down the 6 future AI principles. First, fairness. AI should work equally well for everyone, regardless of age, gender, ethnicity, or socioeconomic background. It should identify and correct bias, not amplify it. Second, universality. AI should be transferable across settings, meaning it should work in hospitals with different equipment, across countries, and among diverse patient populations. Third, traceability. There should be a clear record of how AI was developed, tested, and used. Think of it like a black box recorder for AI decisions, so errors can be traced and corrected. Fourth, usability. The tool must be easy and safe to use. That means involving doctors, nurses, and even patients in the design and testing phases. 5. Robustness. AI needs to keep performing well even when real-world data changes or when faced with unexpected inputs. This is crucial for safety. Last but not least, explainability. Doctors and patients should be able to understand why AI made a certain recommendation. No black boxes allowed. So what makes future AI unique? What's special here is the combination of technical guidance with ethical oversight. For example, developers are encouraged not just to collect diverse data, but also to get consent and involve patient representatives in early design phases. Future AI also distinguishes between AI tools that are still in research and those who are ready for clinical deployment. This is important because not AI tools need the same level of scrutiny at every stage. Moreover, the framework recommends continuous auditing, user training, and governance mechanisms to ensure that once AI is deployed, it stays safe and useful over time. So why should you care about future AI? Well, because it could help us avoid a future where only the most profitable, least regulated AI tools dominate healthcare. By setting clear, consensus-based standards, future AI can ensure that AI improves health outcomes without compromising ethics and safety. This matters when you're a patient, a doctor, a policymaker, or just someone who might one day rely on AI to interpret your medical scan. But let's zoom out. AI in healthcare is full of promise, but also full of risks. The future AI framework doesn't pretend to solve all of the challenges, but it does provide a shared foundation, sort of a global playbook, of how people should build and trust medical AI. The real power of future AI is its very collaborative spirit. By involving so many voices from so many countries and disciplines, it sends a message. AI in medicine must be a team effort, not a tech company's solo act. That's it for today. Thank you so much for listening, and I will see you soon for another tech adventure in healthcare.